Hi, this is Ray, Universal House of Prayer, Bernardo area, Universal House of Prayer, North Carolina. And today's topic is mental health, and in particular, emphasis on two subpopulations: homeless and families in need of services. This is my professional opinion. Uh, I have an BA in sociology, MA in political science. So political science is knowing public policy and so forth, and studying. Both those degrees go hand in hand. And then I have over 20 years mental health experience and child protective services experience and so forth. Um, Here's the thing. Um, in particular, start with the South Wilmington Street Center for Men. Here, people that use that center tend to be the men that just gone through some trying times. For example, you may have a person who got injured at the work. As a result of injury, can't go to work, need to apply for benefits, disability, and so forth, lose their home, lose their job, and lose everything. And or substance abuse, mental health issues. A lot of the population there at the South Wilmington Street Center for Men is substance abuse. It's an epidemic, pandemic, whatever you want to call it, here in North Carolina, in the nation as a whole, as the president points out. And part of the answer to all that is hiring case managers, associate professionals, paraprofessionals, and setting up supported housing programs. Here's the thing: a lot of these people, they may be that car that's a 6-cylinder car, but firing on 5 cylinders, and on the borderline of functional. So they may present well and look like, hey, look, this guy just needs a little help. Operation Bootstrap. And it's not just that, because they are of diminished capacity, albeit minimal, but enough to trigger homelessness or some sort of condition that needs to be addressed. Case in point, I helped a veteran down in this city, and he's one of those people that 5 cylinders, so his car can only go up to 45 miles an hour, not to 70 or not to 120. He's firing on 5.5, maybe 5 cylinders, period. And he's content with being a veteran of over 30 years from one of the armed forces, and doesn't have power, doesn't have water, hasn't paid his mortgage. That is the best type of family for a case manager, person for a case manager. And you have a whole center full of it. So here's the thing: is that the David Harris legacy, one thing that I flaw it for is not pushing for and moving forward with more supported housing programs for those people who are chronically using, chronically homeless, who need extended case management. They don't need the higher levels, the supportive housing, or they don't need institutionalization, but rather what they need is just a long-term case manager. A lot of mental health, North Carolina is known to lack mental health services. Just known. This is what our state is known for. They just don't. We don't want them here, so we're not going to give them services. And they just expanded Medicaid just recently. Just because the people arrived regardless, so now we got to take care of them. So now we'll expand Medicaid, even though we didn't agree with it before. So here's the thing: is that supported housing. Also, let me give you another example. A family, married couple, has a child. and one of the family members has mental illness, and family member could have had 7 children, 8 children, whatever. Here's the thing: is that that mental illness of that one parent causes a stress and a strain on the family. Now, here's the thing with mental illness. Some of the mental illness is combined with substance abuse and some other issues. Some of it is allegedly domestic violence. When you have as a primary diagnosis a person with a mental illness, that overlaps every other area in terms of criteria, in terms of evaluation, in terms of how to serve this family. Person with mental illness can hear voices and see things that don't exist and interpret things in a different light than what a reasonable person would interpret. So, domestic violence is specific acts without the co-occurring mental illness. So, the guy just likes to hit people. You might call them sociopaths, psychopaths, whatever you want to call them. But just as violent. So when they get violent, they get angry, they'll start to hit. That's straightforward domestic violence. Whereas mental health clouds that too much. And so when you have a family that might have a spouse that has mental illness, your best option would be supported housing where they have long-term case management, because mental illness doesn't go away. It's something you have to manage, and some people, a lot of people, well, my experience has been with the mentally ill is that today they're at baseline, tomorrow they decompensate, and you don't know when and where they're going to decompensate, how long they're going to remain, relatively at baseline, relatively normal. You don't know. So that case management, that long-term supported housing concept is there because when they do falter, you are there so that they don't get institutionalized, so that they don't lose their housing, and they don't end up with child protective services cases and so forth over stuff that doesn't justify the need for government intervention. Here's the thing is that, especially those people at the center, one of the pet peeves that I have is that Mr. Harris never made that the focal point of his pitch for services, to my knowledge. This is my opinion, based on what I've seen, and I do research and whatever, I look at stuff, and I don't see where he, I see that he was out at one facility, one supportive environment, transitional housing, but one facility, one place where you need community-based programs. Supported housing is that you house people in different areas in the community, not just a building. You put them in the community and you follow case management. So that, for example, we had one guy when he was good, that dude had a 3-piece suit on, spiffy clean and so forth. When he decompensated, all he had was a hair sticking out on his chest. He overflowed the bathroom and started talking to himself, and so we would have to go in and as part of the supported housing program, go in and clean the bathtub that he overflowed, washing his clothes in, and pay for the damages and get damages taken care of on the floor below or above, and clean up the mess. Have people go in and clean up the mess, and be nicey with the landlord too, because we were housing someone in the community that was chronically mentally ill. Same thing too with mental illness with a spouse. The spouse could just be breathing normally. All of a sudden it's like, I don't like he exists, and that's the person interpreting that they are the victim of domestic violence while suffering mental illness, when the person is doing absolutely nothing except preparing a breakfast in the kitchen. This is the some of the things that I believe are needed in this community, that you have so many people with substance abuse. You know they can't manage their money. You know once they get their money, they're not going to pay the rent. So they're going to end up in the centers, shelters, whatever. So case management, and that's what I didn't see. And case management with reference to kids being pulled away from their families for no good reason. Law enforcement having mental health teams. This is on the news all the time. The lack of mental health teams, especially trained officers, and keeping those people out of the system. They don't need to be a system. They don't need to have their kids taken away and have all these foster care funds be expended for crap. My 2 cents, my professional opinion, my reflection is that we need more supported housing programs, because the population is such, just got too many needs. We got too many people all over the place homeless, and a lot of it is substance abuse, mental health issues. In North Carolina, I don't know where else. There might be better answers to this, but that's the reality here, in my professional opinion. Take care.